I'll start with a rundown of numbers for today. As of this morning, we had 1,837 cases in 83 counties across North Carolina. Of these cases, about 9% are in people 18 to 24, 42% in ages 25 to 49, 27% in people ages 50 to 64, and 20% in people ages 65 and older. We have 184 hospitalizations currently, and we've had, sadly, 16 deaths here in North Carolina. We've completed more than 28,000 tests across the state from labs that have reported their negative tests to us, though not all do. And so I'm pleased to share that we have now more data integrated into our online COVID-19 dashboard. This includes available hospital beds, number of ventilators, information about our requests to the Strategic National Stockpile, and demographic information about cases and deaths in our state. We'll continue to add data. Today, we added data on number of outbreaks in congregate settings. These are settings like nursing homes, adult care homes, and correctional facilities. Many of these settings are designed to serve groups of the very highest risk folks for the illness in COVID-19, older adults with chronic underlying medical conditions. A new study that was just published a few days ago shows that containing an outbreak in a long-term care facility can be exceptionally challenging. Therefore, it's very important to prevent the introduction of the virus in the first place in those settings. We are working very closely with our partners within industry associations, our local health departments, and the facilities on their planning and preparation. We need to be incredibly vigilant in these long-term care settings. Frankly, we all need to be vigilant. We know that there's a lot more to be learning about the virus, but as we learn more every day, it only reinforces Governor Cooper's action that he took this week to make sure that we are all staying home to stop the spread of this virus. Not only is COVID-19 highly contagious, we're learning that there may be many people who have the virus and don't have symptoms, but can still spread the infection to others. That's why we need to each do our part. We're in this together. Our fates are intertwined, perhaps in more ways that we did not originally recognize. That's also what keeps me strong and hopeful. When I see people buying groceries for their neighbors, or teachers leading car parades through their students' neighborhoods, or strangers sending pizzas to doctors and nurses in a nearby hospital, I know that North Carolinians are doing what they always do, pulling together and taking care of one another. The one thing that we can all do together is stay home. It's how, in this moment, we can best serve one another, serve our communities, serve our state, stay home, and save lives. With that, I'm going to turn over to Director Sprayberry.